Hey everybody, Dr. Stanley with Stanley Chiropractic. Today we're going to be talking about our next condition, which is neck pain. Now, people get neck pain for all kinds of different reasons, but most of the time what we see is that neck pain develops as a result of the postures that we put ourselves in all day, every day. The neck is also known as the cervical spine, and it's 7 bones that go from the base of the skull all the way down to the top of the shoulders. Now, those 7 bones are meant to move in 6 different directions. They're meant to bend forward, extend back, lean side to side, and turn both ways. And if those joints are not doing what they should, they start to cause muscle tension, nerve irritation, and discomfort. So you're going to see a pattern as we go through these conditions that if all these joints through the spine are moving the way that they should, most people don't notice any kind of pain or discomfort. But when those joints start losing their mobility, that's when our people really start to notice discomfort. So we have to be involved. We have to take proactive steps to make sure that all the joints of our spine are moving in a way that they should. Our spine is designed to move. It's meant to move. And as we age, if we let nature just take its course, we see our ability to move often reduces as we get older and older. If we let nature run its course, we notice that we start to get stiff and tense and we don't move quite as well as we should. So if we let nature run its course, what we see is that we never move better as we get older. Everyone gets a little stiffer, a little tighter if we don't take proactive effort to make sure that our joints are moving well as we get older. So with neck pain, a lot of times we notice that 1 or 2 of those joints in the neck may start to get a little locked up, and then the other joints now have to make up for that lack of mobility. So we have joints that aren't doing their job, and then now we also have joints in the neck that are overworked because a couple of those joints aren't pulling their weight. So when that happens, we see nerve irritation, we see muscle irritation, we see inflammation, and that causes neck pain and discomfort. Now, most people, when they notice neck pain or discomfort, they start to just pop ibuprofen or Tylenol, take something over the counter to try to get rid of that pain. What happens with these over-the-counter medications is we're not actually correcting anything. We're covering up that symptom and hoping that the body will kind of work through it. But what people notice more often than not is if we don't address the fundamental mobility issues in the neck, this is just going to get worse and worse and worse. And so those periods where they're feeling tight and sore and irritated and pain are only going to get more and more frequent because they're not doing anything to correct the cause of their pain, which is often faulty joint mobility in the spine somewhere. So when someone comes in with neck pain, one of the things we do, obviously, we take a full history and we do an exam to make sure that it's a chiropractic issue. If it's not coming from the spine, if it's not something we can treat, we'll send you to someone who's better suited to handle that issue. But most neck pain is mechanical in nature, meaning that chiropractic care is a great option for treatment. And we see patients with neck pain all the time and we get great results with it. So first and foremost, we usually, if the joints in the neck aren't moving well, we want to get those joints moving well. So we use chiropractic adjustments to restore fundamental mobility to the joints of the neck, and that often takes a lot of that stress off of those other joints and allows some of that pain and discomfort and muscle tension to start to go away on its own once we address the underlying joint mobility issue. A lot of times neck pain and discomfort comes from what we do every day. So a lot of us are spending a lot of time at a desk, a lot of time on computers, a lot of time on cell phones, and the postures we do those activities in usually are not the best. So we usually have to do some kind of rehab. So we give all of our patients some exercises to address some of the muscle imbalances that we find. And then we also can give them some sort of home recommendations to empower them to make changes in their environment to minimize any kind of strain on the neck and spine to make sure that we are getting a long-term correction as opposed to using chiropractic as another form of ibuprofen or Tylenol. So neck pain is a very common issue that we see. We get great results with our patients with neck pain. It's safe, it's effective, it doesn't require drugs or surgery, and it's something that if you stay out in front of it, we not only just get rid of your neck pain now, but we can teach you how to prevent it going forward. So if you or anyone that you know is struggling with neck pain, it's starting to affect your life and affect your ability to work and play and all of these things, you don't have to suffer. We can help. So I'm Dr. Mike Stanley with Stanley Chiropractic. Send us a DM. We'd love to schedule an appointment for you and get you taken care of. We help patients with neck pain all the time, and odds are that we can help you with your neck pain as well. So thanks for watching. I'll see you next time.